Um, Good morning, colleagues and guests, and welcome to this session. We have started, but we will give it 2 minutes out of courtesy to those who are joining a little bit late. So, in 2 minutes time, at 12:02 Lagos time, we will start. Thank you. Okay, and it is 12:02, so as promised, we'll start now. Um, if you are in Nigeria, good afternoon, and to everybody else in the time zone later than 12 p.m. If you're in a time zone earlier than 12 p.m., good morning still, and welcome to this session. This is our first information session for the first RFP for Grand Challenges Nigeria. And I'll introduce my team, I'll provide some guidelines, and then I'll do a general introduction of the project. And then my colleague will take over and we'll get into the meat of today's session proper. So first of all, to introduce the team that you're seeing, we've got Professor Falake Samuel. Professor Falake Samuel is the program director and technical lead for Grand Challenges in Nigeria. So she is, to say, the overall boss for the program implementation in Nigeria. I've got my colleague, Dr. Adedotun Olabi. Dr. Olabi is the technical and information manager. And so he is pretty much the head of our grant process and also liaises with the technical review committee. And so he's the technical brain behind everything we're doing. I've got a colleague. She's not one of the presenters. She's Aminat Ajishigiri. She is also online somewhere, providing some technical and logistics support to the project as well, to the this event as well. My own name is Godwin Bamsa. I'm the program manager for Grand Challenges Nigeria. And so we're happy to see all of you at this webinar. Some ground rules. And for those who have been attending webinars, I think this is not news, but we'll just say them anyway. We, the presenters, will be able to speak so that we can keep control over what is happening. However, you are also able to communicate by chat. And we already have a few colleagues who are introducing themselves in the chat, and thank you very much. We'll try to engage as much as possible. So you can introduce yourself, you can chat, you can comment in the chat. However, if you have questions, the right place to post them is through the icon labeled Q&A. So those we will be monitoring more than the chat, and we will be prioritizing them. So if you type your question in the chat, we may miss it given the volume of chats that will probably be going on and engagement. But if you type it in the Q&A, we will not miss it, and so we'll be able to address it quicker. So please do type it, your questions in the chat. And without further ado, we will jump right into it. First of all, we'd like to introduce Grand Challenges to you. Some of you who have already been on the website or been following our social media channels, or who are aware of other Grand Challenges programs will probably be more familiar. But the Grand Challenges as a concept itself focuses on identifying, seeding, funding, and scaling innovations in health and development around the world. The idea is, if we define very specific problems and we are able to get concerted efforts around those problems and provide significant resources, both in funding and support, there's a better chance that we can shift that problem and have a positive impact. So that's pretty much the idea. And so the network of Grand Challenges programs, will identify different areas. Of course, the priorities will also depend on which regions have been focused on. So Grand Challenges Africa, for example, will look at an Africa-wide remit in how it is defining its problems. And Grand Challenges Nigeria will look at a Nigeria remit and how it is defining its problems. But often we will also link to the global Grand Challenges of RFPs that are kind of similar and try to create a community of practice of innovators around solving those problems. Even if it is localized to certain areas. And so that is the framework that we use in addressing Grand Challenges. Some of you will already be familiar with Grand Challenges in other countries. Some of the more popular ones are Grand Challenges Canada, Grand Challenges Africa. But there's a lot of Grand Challenges around. We are actually probably the 7th in Africa. There's South Africa, Ethiopia, Senegal, Rwanda, etc. There's Brazil, China, and other countries. And so this year we launched Grand Challenges Nigeria. The Grand Challenges, has had remits that have overlapped with Nigeria in the past. So Africa has an Africa-wide remit, which includes Nigeria. So we've had Nigerian innovators and researchers who have applied and who have received grants and funding and implemented them under Grand Challenges Africa. Grand Challenges Canada, for example, has a remit for Canada and developing countries. And so we've had Nigerian researchers and innovators who have also benefited from that. But we've not had a Grand Challenges for Nigeria specifically until now. And so the Nutrition Society of Nigeria decided that, it was going to establish this. And why the Nutrition Society of Nigeria? I'm a trained nutritionist, as are my colleagues here as well. Our training teaches us that we address issues of nutrition first, not in isolation. That's because you need others to be able to address issues of nutrition, and you need to address issues of nutrition in context of other problems. The technical words there are that they are multidisciplinary or multi-sectoral. And the way that Grand Challenges work is, when we define problems, we want all the best brains, regardless of where they are seated, whether they have the core expertise or not, to come together and try to solve the problem. So multidisciplinary and multi-sectoral. And so the Nutrition Society of Nigeria felt it was best placed, given its approach to solving problems, to pull the secretariat together and establish it for the country. And so we're grateful and indebted to them for this. We're also grateful to other partners who have come on board very early, recognized the vision and the potential of this initiative, so including the Federal Ministry of Innovation, Science and Technology, the Office of the Vice President, and others who are on the advisory board, like the National Nigerian Institute for Medical Research, the Nigeria Stored Products Research Alliance, FHI 360, Aliko Dangote Foundation, Dalberg Global Advisors. We're grateful to all of these organizations who are helping us shape the vision and the direction. So I'll stop with the date, but for this RFP in particular, it's our first RFP. The focus is maternal, newborn, and child health. And as the years go by, we will be creating a pool of innovators and researchers as a community of practice in Nigeria, and also synced with other Grand Challenges programs across the world who are helping to solve these problems for Nigeria. Over time, this particular pillar will also evolve. So we will call subsequent MNCH RFPs, and they may differ a bit, based on how we are defining the priority issues for Nigeria. But we will also call RFPs in other pillars as well. And so please do stay tuned for that. So for colleagues who think their work is not in MNCH today, there will be other RFPs. That being said, the last thing I'll also say is this is a seed RFP. And so what that means is we are giving funding, for early stage ideas with potential. We will support those who we fund to implement and to make sure that their implementation is done well and has potential. We will then provide scale-up funding for those who implement properly. So it is not a one-off funding. The funding will evolve over time as we are identifying the ideas that have the most promise. And so for this particular RFP, Advancing Innovative Solutions for Maternal, Newborn, and Child Health, we will talk you through what our expectations are and help guide you and your teams to give us the best proposals you can get so that we can get the best solutions for this country. Thank you very much. If there are questions, they can go in the Q&A. I already see that we have a few, and I'll hand over at this point to my colleague, Dodson.
Thank you so much, Babsa Godwin, for that introduction, for setting the pace. Good morning, everyone. Good afternoon and good evening from wherever you are calling in from, you're dialing in from. We welcome you indeed to the RFP Application Information Session 1 on Advancing Innovative Solutions for Maternal, Newborn, and Child Health in Nigeria. So we felt it was important to share with you and show you this first slide on key dates and deadlines for this RFP. Yes, we have requested for proposal and we already seen some submission already of some proposals coming in. Some also are in progress. And today we are having the first information session and we're going to have the second one in January. And then we have the proposal submission will end in January 31st, on the 31st of January 2025. Between January 31st to 2025, we would have a reviewing session. Then the proposals will be reviewed. And then, of course, that should be completed by the end of March 2025. In April 30th, 2025, we will be selecting and then we'll be awarding the grants to everyone who we have finally selected. At the end of announcement and the award of the grants, we will have a due diligence and contracting with the selected last 10 grantees or potential grantees who will be working with for the next few months that this will be on. So we thought it was important for you to have this information on these deadlines again, so you can keep that to yourself and then as you work towards your applications. So indeed, Bamsa already mentioned quite a lot around grand challenges, global grand challenges projects, and also, of course, the Nigerian version, what we're looking forward to, and all of that. He's mentioned a bit about the initiative. So we are a partner initiative. We are committed to driving innovation that addresses critical health, food system, and development challenges across the country, within Nigeria. And that's why one of the criteria for application is that the project must be in Nigeria, and then the lead must also be in Nigeria and all of that. So because what we want to do is to see how we can address these challenges across board. The mission, of course, for GCNG, we want to build a platform for jointly identifying strategic areas for investment and innovation, thereby fostering a dynamic ecosystem where Nigerian innovators, researchers, practitioners, as well as businesses can unite, and then we can address those local challenges that we faced within Nigeria in health, in food system, and development in general. So at the end of the day, we might be able to add some more improvements, some more support, of some more progress to the Sustainable Development Goals, which has less than a few years to go. So this is one of our main goals, to ensure that we achieve some of these targets by the end of 2030. So like I said, we want to foster a dynamic ecosystem where local researchers, practitioners, and innovators can collaborate to solve complex but relevant local challenges. We work by providing funding, and so that's what we are currently doing: providing funding, capacity building, and of course, a strategic partnership, which we also, as much as possible, we engineer within the system, within the country, within the ecosystem of practitioners that we have. We hope that this whole process then can help in improving the health outcomes and enhance food security that promotes sustainable development in Nigeria. So, what is the objective of this session in particular? We want to see how we can help you shed more light, provide more guidance on the application process, including the scope of the call, eligibility criteria. We want to answer your questions, and then also grant you some tips for crafting a very competitive application. The truth of the matter is, quite a lot of people will apply for these grants, and you can imagine that we are only selecting just 10 for these grants. And so, as much as possible, we want to see how we can help you indeed craft and develop, then of course submit a very competitive application at the end of the day. So indeed, Bamsa mentioned the scope of this call, which is maternal, newborn, and child health. And so the question is, why maternal, newborn, and child health? The recent NDHS shows that maternal mortality ratio is between 512 deaths per 100,000 live birth. That keeps increasing by the year. And then, of course, pregnancy-related mortality ratio is also about 556 in every 100,000 live birth. For children itself, for infant mortality rate, about 67 deaths per 1,000 live birth under the age. And of course, for children under the age of 5, we have about 132 of them who would not survive, out of 1,000 live birth. Nutritionally as well, we see that about 68% of children less than 5 years old are anemic. Between the different types of anemia, it could be mild, it could be moderate, it could be severe, but we have about 68% of Nigerian children who are less than 5 who are anemic. So that makes about 7 out of 10 children in Nigeria are actually anemic. And then also for women, we have about 58% of them between the age of 15 to 49, also anemic. This is also quite on their high. About 37% of children also between less than 5 years old are also stunted. That means they are too short for their age, and so this is also an indices that we also think it's not reducing. It's at some point reduced and then of course went up again. 28% of women are also overweight and obese. So it is very important to see that it is quite ironic to say in a country where 78% are facing food insecurity, we are also seeing an increase in women overweight and obesity. And so this situation is becoming so very much over the years, we've seen a lot of organizations, a lot of investment that has gone into this country. I mean, with regards to seeing how we can reduce this situation and then enhance the whole process of and the outcome of the maternal, newborn, and child health. But then, despite all the investment, we have not been able to reverse the situation within this call. And this is why we are calling for a proposal for those innovative ideas and initiative to help us see how we can put some solutions behind the maternal, newborn, and child health. So the request for the proposal is to drive bold innovative solutions to improve the MNCH, of course, thereby accelerating the progress towards the Sustainable Development Goals and a healthier future for all Nigerians. Uh, so for the call, we also have showed, or we have also mentioned and stated the different sub themes which we think, or we are hoping that we can get applications from. And number one is the accessible technology-driven solutions for maternal, newborn, and child health and diagnostics. So we also have given a bit of a breakdown of what we're talking about. We're talking about low-cost diagnostic and monitoring innovations in maternal, newborn, and child health care. It is very important to understand that in an environment where about 43% of Nigerians are poor, are living below the poverty line, it is almost impossible to expect this population to be able to afford healthcare, expensive healthcare. So we're looking forward to seeing those solutions that can help drive those low-cost diagnostic and monitoring innovations within that MNCH sector. Telemedicine, digital and mobile health solutions in MNCH. Yes, telemedicine and digital mobile health are very new, not very new, but at least, I mean, to some extent, in developed countries, something that we are processing that already everywhere. And so it helps reduce the burden on the healthcare system. It helps reduce the burden on the infrastructure of the healthcare systems and so on and so forth. And then it also gives the process of healthcare, I mean, very easy, and also make it very accessible to everybody, and also probably affordable. And so these are solutions we are also looking forward to see in accessible technology-driven solutions for MNCH. We're looking at point of care diagnostic innovation in maternal and newborn and child healthcare. This is very important. And so this is the first aspect of the sub-teams we're looking forward to seeing some innovative solutions. Secondly, we are also looking forward to receiving applications from on topics like strengthens maternal and child health through nutrition innovation. An example is a micronutrient supplementation, fortification, and biofortification innovation for maternal and child health. This is very important also because, I mean, if you take a look into the statistics which I gave earlier with regards to anemia, you can imagine that, yes, quite a number of children in Nigeria less than 5 years old are anemic. And there are different causes of anemia. It could be because there's a low intake of iron, right? And it could also be that they are iron, the biological availability of iron being consumed by children less than 5 years old is quite very low. We want to begin to see what kind of innovation can come in here and yet still affordable, available, and also accessible to every mother and child. So anemia does not know gender, anemia does not know age. So you can imagine mothers are anemic, children are anemic as well. And so we're looking for those solutions within this system. What kind of food fortification can happen that can support, and sustainable process as well. Sustainable, when we talk about sustainability, we're talking about across the value chain from wherever it's coming from to the end. You don't have to, we're talking about solutions that does not require you to probably import from anywhere across the world. Then importation also makes solutions very expensive. So these are few kinds of solutions we're looking forward to. Maternal, infant, and young child nutrition and innovations. We've had quite a lot of challenges between on what kind of nutrition should children eat, should children consume, to ensure the development and growth with at least in the first 5 years of life. Mothers have in fact provided quite a lot of different types of food for the children, and yet we still have quite a lot of challenges with children having to be deficient of some nutrient or the other. We want to begin to see some solutions within this area, and then we would be grateful to see those kind of applications. And then the third sub-theme is the future-proven diet for maternal and child health. We're talking about sustainable agricultural innovation to improve dietary diversity, and then climate resilience for food innovations to improve dietary diversity as well. Dietary diversity is something also a subtopic that we know, I mean, across the country has not gained quite a lot of ground, especially because people have eaten or have consumed only food that are only available to them and affordable to them, and we want to begin to see. And of course, farmers themselves have not been able to put in quite a lot of innovations across the plantations and cultivations due to some reduced level of innovation. So we want to begin to see what kind of innovation exists within the system, within the agricultural system, that can support food dietary diversity for children and also for mother across this value chain. So what are the eligibility criteria that we have looked for, we have put out for this call? The first is that the lead applicant must be affiliated with a registered organization or an institution that has been in existence for more than 2 years. And there are quite reasons why this is included. In fact, this is also a global practice and a best practice across the world to ensure the sustainability and also ensure the credibility within the 2 years that you've been working in that same organization. We also want to understand the interest of that organization where you are working, and and also have the buy-in of the majority of the stakeholders of the organizations where you work. And this is why this is one of the major eligibility criteria that we needed for this call. The lead applicant's organization must also be legally registered to operate in Nigeria and in good standing with relevant regulatory authorities. Eligible organization also must be registered non-governmental organizations, and profit organization as well can be included. And but we excluded sole proprietorships, right? Private and public research institutions within the country, yes, private and public academic institutions, research centers, and social enterprises are also eligible to apply for these grants. Individuals with institutional affiliation but who are not applying on behalf of their institutions are eligible to apply directly, but the project will prioritize funding, of course, for the institution organizing application from collaborative team or partnership. So this is going to help us also to find a grant for who is applying. So while we also said local and international collaborators are encouraged, the lead applicant or the principal investigator must be Nigerian and affiliated with Nigerian organizations or institution. In the introduction, Gordon Bamsa also mentioned the fact that there are other grant challenges projects across African countries, of course, around the world as well. But as much as possible, the Grant Challenges Nigerian project or initiative is specifically for Nigerian community and ecosystem. So as much as possible, we want to drive the innovation, through the Nigerians who are seriously working in the system. And so this is why we have made this a criteria for everyone. Applicants must also have the necessary expertise, resources team, and of course, the infrastructure to successfully implement the proposed project. This is also because if you have to outsource quite a lot of your activities, quite a lot of your processes to an external body organization, it becomes more expensive for you, and then in fact the solution might also become more expensive for the populace, and then not accessible to everyone, and that's not what we want to achieve. We want to ensure that the solutions you're providing will be accessible to everyone, and as well at the same time affordable to everyone, to the government, to the consumers, and to the public who are going to access this particular local solutions. And so what we think is important, what we believe is important, is to ensure that you have the expertise in place, resources, as well as the team infrastructure to successfully implement this particular project that you are proposing to us as an innovation. Applicants must also have a proven record of accomplishment of working in the thematic area which we have talked about, the MNCH. We want to be able to see that you've done quite a number of other research or work or innovation within the same MNCH call. And that's also because it helps you to also prove your credibility in the area of your expertise as an organization or as a team of collaborators. And this is very important for us as a criteria for the team. We want to be able to see the track record where what you've done before in the past, and then we can then put that into context, especially for the applications you are making. The proposed projects must be implemented within Nigeria. This also further validates the initial points on why we want this project to be led by Nigerian. The project must also be implemented within the country, Nigeria, and not outside the country. The final two is that the team or the organization that we received any grant challenges or other fundings in the past are eligible to apply. But we also want to see see how you demonstrate how the proposed project differs from the previous work which you have received funding for before. So in case you have received funding for a particular project, you are not allowed to submit that same project into this particular call. We want to be sure that you are submitting a fresh idea and innovation, and especially one that is peculiar to the system we are talking about in Nigeria. So indeed, we want to be sure that that is quite different from that. Applicants must be willing to participate, of course, in monitoring, evaluation, learning, dissemination, and amplification activities throughout the project implementation period. We have created an open access guide document, which is supposed to lead and guide you in this particular discussion. What is very important is we've seen quite a lot of projects within the country, with quite a lot of innovation within the country that lacks monitoring and evaluation process. And so you are unable to assess the impacts. And so that's not what we want to do. We want to be able to assess impact of your solutions. And of course, the whole process that you go through in ensuring the solution is in place during your implementation and all of that. So in fact, monitoring and evaluation is very key for us. And of course, during the review, there is a monitor and evaluation reviewing part that we are going to take a look into. And so you will find out that in part of the document we ask you to submit, monitor and evaluation plan is also included. This is because we also would like to measure impacts at the end of the day. It does not end there. It's not enough to measure impact. We also want to see that the larger population and the larger ecosystem also see some of the solutions and innovative initiatives that has come out of this particular project and this call. And so hence, we will want to be able to see how we can disseminate your information, disseminate the outcome of your study or the outcome of your innovation or initiative to the general public and, of course, to a larger stakeholders. The larger stakeholders, of course, the funder as well, and so on and so forth. And so this is also why we are asking that you take a look into the open access guide document, and then that will help you to be able to know what exactly are we looking forward to with regards to the dissemination of the project. So this is what the grants application process looks like. So we have a grants management system that is set up and is launched already now, which you have all gone into and then registered, and you probably already started your application or already submitted. And for those who have not started or applied or submitted application, so this is where you start from. You go straight to the grant management system, which we have sent across, and of course it's also on our website. And then you can first register there on that application, on that grant management system. Once your application comes in, we have the different levels of reviewing that goes into the application. And then at the end of the day, we notify the selected set of grantees, and then we disburse grants. And then we also have the grant management and reporting that happens, and then of course grant evaluation and then the closure. So I'll start by doing the step-by-step guide on the application process. So for the application process, we are asking you to go straight to the website. You have to first log in, register an account, and then of course you will receive an email with a code that gives you an information on your password. Once you do that, You can then, of course, go straight to the information where you see the start application, and then where you can start your application for that process. After the application, like I said, we will be reviewing, and then so all proposals will be reviewed by panels of globally recognized experts. And then, of course, accepted proposal, we undergo 4 major review stages. So number 1 is the administrative review. At the administrative review point, we are checking completeness, we are checking accuracy of the submitted applications. We want to be sure that the necessary information that we required has been submitted. Yes, at the beginning of the application, you'll have the eligibility questions where you have to answer about 7 questions to be eligible. If you do not answer the 7 questions, you can't apply. You cannot move further to the next stage. But then it is possible to be eligible to have answered the 7 questions correctly and then move straight to the application and still not input or record the right information we requested for. And so this is what the administrative review is going to take a look into, to check correctness of the information that has been imputed. And then if we think some information are missing, and then we can actually send you an email to say, well, we think this information, can you get us this information, and then can you review your application and then resubmit again. So that's very possible for us to do in this process. We have the technical review stage. The technical review stage, after the administrative review has been completed, we move the applicants straight, application or the proposal that has been submitted straight to the technical review experts who have been selected globally, not just in Nigeria. We selected them across the world, and then who are experts in their field, especially in MSCH in this particular call, and they are going to be reviewing your applications. They're going to be reviewing your applications with defined criteria that has been shared with them, that will be shared with them, and then once this is done, it comes back to the team, and then we'll send, of course, the monitor and evaluation consultant. The organization will also go ahead and evaluate your monitor and evaluation plan for your project, and then, of course, review it. And lastly, we have the board. The board of trustees, of course, we also reviewed the application, and this is where this is a final level of revision is done. The board will review this based also on evaluated on criteria that are shared here: originality and creativity of that proposal you submitted, the innovation within it, scientific and technical excellence, scalability, because it's not enough. Also, just like we mentioned, this is a seed phase, and then there's also the scaling up phase, of course, of this particular call. So it's not enough to just submit an application. We also want an application that can be scaled up. It's not your application is not accessible to many when we cannot scale it up. So that's very important for us. It's a very important criteria for the team: scalability, potential for impact, and then alignment with the thematic areas of focus are going to be used as criteria for the process, for the different review stages that I earlier talked about. Shortlisted applicants may be invited, like I said, to provide additional information or participate in an interview as part of the evaluation process in case we feel that there's a need for us to get some more information from you. Yes, you may be invited to an interview or requested to get more information from you. So as I mentioned earlier, we want to also ensure that you have the right information to be able to do this application. And so we are also going to be providing some proposal tips. We think it is important for you to clearly articulate the local context of the problems you are trying to solve. The problem is quite enormous, and you and I know that. And so as much as possible, it is very important for us to understand in what context are you trying to solve this problem? What is the solution you're providing, and how does it translate to the local context which we are looking forward to? We are also encouraging you to focus more on measurable impacts. I mean, this is very important, and this is why we have included the monitor and evaluation as part of the reviewing stages, because we want to measure impact. We want to ensure that the ecosystem, the Nigerian population can enjoy the solution. So in fact, we want you to indeed focus attention on measuring impact and scalability, and of course the sustainability of your solutions. We encourage you to please emphasize more on community engagement and stakeholder collaboration. It is not going to be a sustainable solution if the community are not engaged, or if you don't understand from the point of view of the community what solutions you want to provide. And of course, I mean, if you don't also understand from their point of view what solutions are needed in their environment or within the system or within their context. So it's always important to ensure that you are stakeholder centric with regards to your solution. Use data and evidence to strengthen your proposal. That's important because we are driven by data. Solutions are driven by data. Solutions are driven by past problems and challenges. And so, as much as possible, these data are also very available everywhere. And so we want to ensure that you use data and evidences to strengthen your proposal and also strengthen the solutions you're trying to propose to us. We are asking that you please avoid generic solutions. As much as possible, tailor your approach to Nigerian needs. Let's as much as possible avoid Dr. Google and every other online online AI driven or AI generated information, because that will not also solve just most of our problems that we are looking forward to. The most pitfalls that we have observed in the past is that people submit incomplete applications or missing required documents, and you might not be lucky enough to be called to submit an additional information. I mean, it could be, because there are other people who are also submitting a big, very smart and intelligent application. So as much as possible, we are encouraging you to pay attention to details before you submit your application. Ensure that you have complete applications in place before you put them out to us. There is also the case where we see that a lot of applications lack alignment with the thematic area. We are talking about maternal and newborn child health, but then it is not out of place. We begin to see that some people are providing sending or submitting applications out of the scope of MNCH. And this is also what I'm talking about. That will not grant you, or that will not give you a chance or provide you a chance of being selected at all. And so we ask that you kindly ensure that you align your proposal and your applications to the thematic areas which we have this call. There is a failure to demonstrate scalability and stakeholder involvement. Just like I said earlier, the scalability is very important for us. And so as much as possible, we want to ensure that the solutions you're providing is scalable enough, has the potential of being of scaling up, and then of course increasing the impact among the communities and societies. And we also want to ensure that you are engaging the community with which you are providing the solution for. So that's very important. Overestimating and underestimating project budgets is also a common pitfall that we have observed among applications. Too many times the solutions. So too many times, because we have given a particular range of funds, of grants, we see a lot of people who have matched up to that particular amount of money, when the solutions they're providing actually probably do not require quite a lot of money. So as much as possible, we want you to be very realistic with your estimates, and also ensure that you are not underestimating, neither are you overestimating. As much as possible, stay within range, and that will be very okay for this application. So that's all from our end. We have frequently asked questions on the internet, which we ask that you kindly just check And then if you have more questions, you can send that to the support email, which you have here on the screen. Thank you very much.
Thank you, Dotun. Thank you very much. We are checking the Q&A, and we see that there are no open questions. We've been looking into the technical issues for some of the people who cannot see the Q&A. We've been able to determine that if you're joining on your mobile, the Q&A does not show up. So we will try and investigate why this is the case. For those joining on mobile, if you have questions, please put them in the chat and we will pick it up from there. We're sorry that you are not able to see the Q&A button if you're joining on mobile. For those joining on the laptop devices, please go ahead and put your questions in the Q&A and we will try to address them. Unless, of course, Dr. has done a terrific job and everybody's clear and gearing to go.
There is already a question
Yes.
by Babale Gambu Maikidi.
So, Dr. There's a question. It says, for coverage, for locations, is there a specific number of states that the application can take? So my suggestion would be that for this question, maybe we'll break it up into a couple of parts. So which means if the applicant is thinking of scalability, how many states should they say they want to implement in before scalability before they can be considered as scalable? The second way the question, we can also take the question is, are there states in the country that, our RFP is prioritizing? So if you can take those two questions, please.
Can you repeat it again? I think I get the first one. How many states of the country do your implementation cover before we can assume scalability? Is that the first one, right?
That's the first one. The second one will be, is this RFP prioritizing any states in the country?
Okay. Okay, so thank you very much for that question. So I'm going to start from the second one. So this RFP is not prioritizing any states in the country. We rather are prioritizing the theme across the country. We are not specific about any country, about any states in the country. So it's a national or MNCH challenges is national and not statewide. So as much as possible, we are looking forward to receiving applications from any part of the country. Now, that leads to the second question on scalability, especially because scalability is not defined by the number of states where you can be implemented, where your projects or solutions can be implemented. It is more about the fact that can this solution be replicated in any part of the country, and if there is funding, if there's more funding across or around that solution, it is something that can be accessible, affordable, and of course available for Nigerians within the MNCH sector. And so that's what that's all about. It's not about the amount of the number of states where you should be implementing. It is about the fact that can that solution be replicated in any part of the country, and can anybody in Nigeria benefit from your solution? That's what that's all about. That's the scalability criteria is all about.
Thank you.
I hope that's answered that question. Yeah.
Yes. There is a question asking if they can get a Word document of the, can you share a Word, sorry, 1 second. Can you share a Word document of the application form?
So as much as
I think Dotun is having connection trouble. So let me just take over answering the question.
Abrams, are you talking?
Yes, your connection is not coming through. So I was going to answer the question while you just check your connection. So, Dr. Elsa, Professor Elsa, there is no Word document for the application. However, I'm dropping the link to all of the RFP documents in the chat. When you start your application, so as soon as you register, before you commence, checking your doing the eligibility criteria, you can download all of the questions as a PDF. So that we have provided for on the grant system. So you need to register on the grant system and then you'll be able to download all the question sets. I hope that answers. Okay, so the next question then, let me go to the Q&A. I'll come back to the chat in a bit. So there's a question in the Q&A asking if there's a soft copy for the online version. So the answer is the same as the one that I have just provided. There's a question by Babali Gambo saying on the focus of the themes, can a proposal focus on a specific theme out of the three earlier explained, or a specific or a successful proposal must cover all three themes?
Okay, so thank you for that question. The proposal does not have to cover the three themes, sub-themes that we earlier talked about. Rather, I mean, it can just be one of them. We are not expecting to receive application from everybody focusing on the three thematic areas or sub-thematic areas that we have there. Yes, it can be any of them, actually.
Okay. So just a follow-up question, which I will just respond to verbally. Professor Said is trying to confirm that there is no template for the application. So I mean, according to how you define template, the answer will have to be no. But what we have provided as a template really is that PDF, which your team can then use to plan your answers in advance and then start the process online and put in all your answers. Dr. There's a question here asking if staff salaries and consultant fees can be included in the grant application proposals.
So we've answered quite a number of questions on the budget and budget narrative, as well as what part of the grants can be part of.
Sorry, Dr.
Can you hear me?
Yes, I can hear you. Sorry to cut.
Okay.
There is also a question, so you might just take the two together, asking if you can speak on completing the budget template.
Okay. So I'll start from the first one indeed again. So for the budgets and the grant allocation breakdown, we have in the budget templates and the narrative that you have, we have also created a narrative around the type of the costs that can go into the grants you received. So there is the indirect cost, there is the direct cost as well. And so we have also given a particular percentage to which we think your indirect cost can be, and of course the direct cost, which are very more important than the indirect cost. The direct costs are more like the costs that are directly associated to the project itself, and not the running of the organization. So the running organization is more of the indirect costs, which also talks about the staff salaries and all of that, but there's a particular percentage which we have stated or mentioned in the document, which you have to take a look at. Please download it and take a look at it, and then you can decide what percentage of the grants you would like to include in the template as for your staffing or staff salaries and all of that. But as much as possible, we also want to ensure that you are not spending all the grants on staff salary, because a lot of time that's what usually happens across the world, not just in Africa or Nigeria or whatever it is. There's always that chunk of the staff salary that the grant can consume. And so as much as possible, we want to ensure that the money or the fund is going directly to the projects and not just to pay salaries. And the second one is that the second question on how to fill the budget template. The budget template is such already interactive document that you can just fill in the cost right there into the document. And so you do not have to convert it to a Word file. You can submit it you can fill it in and then submit it like that. I think that's quite easy. It's not the usual PDF file, but of course, like I said, it's an interactive PDF file. I'm not sure if that's the right word to use, but Bamsa probably is a better guru in this regard. So
no, I think that question suffices. So let's switch to the Q&A and take a few questions there. There's someone asking, their organization turns 2 in February, and they want to know if they still qualify, given that it is within the reviewing period. So the reason why we're smiling is we probably should have thought of this question, so we didn't, and we don't want to give you an answer here. So my suggestion would be, Dotun, will this question kick them out during the eligibility?
So it's something we probably have to consider to see that the question is not actually going to kick them out on the eligibility. I don't think well, I'm not sure, but
okay.
I have to check.
So I think, Faith, what you can do is, if you can please write us at info.gcng@nutritionnigeria.org, and then we will probably have to think through this question specifically and respond to you. We're sorry we didn't exactly think through this, and I think we should have. But we don't want to give you an off-the-cuff response. So please do write us so that we can reach out to you, and then we'll try and answer this question specifically for you. So that question will remain unresolved. For others who might be interested in that question, we will add it to FAQs when we have agreed on a response to it. So for Anne Maria Anogu, so we've seen your question in the Q&A. You've talked about the sub-theme you'll try to address and how you want to address this. Unfortunately, we are not able to tell you if that qualifies or not. That's a judgment that you and your team will need to make to determine if, according to the things we're looking for, it meets it. The team at this level are not part of the technical review committee. At most, probably at the administrative review, where we're checking if all your documentation is complete, and that's it. The proposals then go to the technical review committee, which is an international cohort of experts, and it is at that level that they then determine, do these meet the criteria that we're looking for, potential for impact, potential for scale, is it innovative enough, and things like that. So it might not be the response you're looking for, but unfortunately, that's the answer that we want to give. Doctor, I think you like this question. It's asking, what is the maximum percentage for salaries? Can it constitute 100% of the grant?
So just like that the grant is focusing on MSCH and not staff salaries. So 100% of the grants, no, I think we as much as possible are looking forward to receiving the solutions, right? Of course, we know that at one point you would have a percentage of the effort put in, of course, from the staff, and we have also mentioned that you can indeed you can include that in the budgets, of course, in the of the grants. But as much as possible, we in the indirect cost policy, we also have talked about the maximum of about 8%, if I'm not wrong, about 8% of the total grant should probably be in the indirect, should be part of the indirect cost and not 100%. About between 8% and 15%, and 15%, especially if you are inviting collaborators from abroad or something, or you have to do something from abroad, and that's why we included the 15%.
Okay. So we'll switch again to questions in the chat. From Tajuddin Bamidele, there's a three-part question here. So, before I give Dotun this question, please, I'd also like to encourage everybody attending. Please go on the website. I posted the link earlier. And look at the RFP document. So there are quite a few documents there that provide very detailed guides. And Dr. is going to speak to one of them as he answers this question. So Dr., the first question is, does this call support basic research?
It depends on what the definition of basic research is all about. One. Secondly, like we also mentioned, we are looking forward to solutions. If the research provides solutions to the major challenges or to challenges of MNCH within the country, we have also developed a document where you can differentiate between a research project and, of course, or a development project. So if you take a look at the criteria or the definition for research project, see if what you have or what project you are proposing falls within within that, then I think, yes, you will likely be eligible to be you're eligible to submit, and of course we have to go through the reviewing stages to be sure that you are selected or not.
And second, the big question is, what happens in case one has to perform an aspect of the proposed study outside the country? So I think if I can also maybe help here by providing additional detail, in some cases, maybe it's a clinical study, and the only place to maybe test that do the clinical aspects of it is outside of the country. In some other cases, maybe it's digital, and they cannot find the resources to maybe do some of the coding in the country. But in some other cases, maybe they actually want to do a part of the implementation outside of the country. So they might want to address all of them because the implications will be different between the first two and the last one. Hi, Dotun.
Yeah, can you hear me?
Yes, do you want to respond?
I didn't get that. So do you mean the last question, the LOS, or
yes,
which one are you talking about?
Yes.
Okay. So letter of support from a senior staff is
Oh,
acceptable
no,
or not?
hold on. Hold on. No, it was actually the second question. So let me just respond. Maybe in my response, it seemed like I was providing an answer. So I kind of broke it down into, doing some aspect of the proposed study outside of the country. In a case where maybe you're doing a clinical test. So let's assume your proposal is probably taking blood samples and you need to test it, and there's nowhere to test it, qualified place test it in Nigeria, then it will be fine to include something like that in the proposal to test it abroad. That's fine. In some cases, maybe it's a collaboration between a Nigerian institution and a university somewhere else, and you want to send the samples there to be tested. As long as the ethical issues are clarified, that partnership, would make sense that, you want to send it there, given the fact that the other partner institution will probably cover some of the cost and other things like that. If, however, what you want to do is that maybe you want to test an implementation in a community and a group of people, and you decide that you want to do some of the test cohorts in Nigeria and some of the test cohorts, I don't know, in Ghana, for example. Your study design is then a little different, so you will probably need to consider that, and those are some of the areas where Dr. said maybe we need to ask you a few more questions and things like that. But if you want to implement fully outside of the country, then that is not an innovation for Nigeria. That will be for the country in which you're implementing. So that, I think, will not qualify. So I hope this helps. Dr. Do you want to answer the letter of support question, whether it can come from a senior staff?
So thank you. So for that question, yes, indeed, we are also asking as part of the criteria that you get some support from the organization or from the organization or from the team which you're working with. But if you ask me, I think we would tend towards getting the letter of support from the management of the research institute or the organization which you're working, rather than just a staff of the organization.
Okay. So let me just go and see if we have other questions. So there's a question that's been asked around equipment, and Professor Falake has responded to that in the chat. There's a question asking if research work is supported. Dotun has responded to that already. So, Dotun, there's a question asking if the organization can utilize funding to expand current infrastructure, such as building and institutions, to ensure optimal implementation. So I think this is already covered in Dotun's response to the budget. So I think it's going to have to be the same answer. And then we'll ask you to please refer to the guide on budget to know how you are allocating those and how you're using it. So there's a question in the Q&A asking, for successful applicants, will there be sub-granting to others? It's similar to the last one, but Dr. I think you can just take that one.
Okay. Yes, we message that yes, indeed, you might have the need to outsource some of your activities or process to another organization or to another outlet or something. So yes, that's possible. That can form part of your of the project. I mean, it has to be included in the grants, in the grant budgets document that we share with you. So you can share, you can let us know what percentage of your of the fund is going to a sub contracting organization. So in fact, I think there's a column or there's a role in the budget template on subcontracting. So you can just put that there. So you are allowed to subcontract, especially when you do not have within house the capacity to be able to do that. But then, of course, we believe that you will do that with all within the guidelines or the information we have given out on permissive level of fund
Okay.
that can be used.
So, Professor El-Sayed, I missed your follow-up questions, and I see that one of them has been answered. 80% of the budget, it says 80% of the budget should be spent in Nigeria. What if I buy equipment from abroad? And the response there is that we do not envisage a project will spend 80% of the budget on equipment. However, if equipment are imported, they will expectedly be used in Nigeria and solve a problem in Nigeria. So, of course, case by case basis, it just might be that maybe for your project, the innovation there is the equipment really. So we would not want to either give a pass or a fail. It will really depend on what the innovation is, and also the guidance that Professor Folake has provided. And then the second one is a simple one, Dotun. So if there is no template, will the 10-page proposal be accepted?
So that's why we asked that you fill the information online on the grant management system, because the grant management system has a word limit. So we already envisage that we can have quite a lot of lengthy information. So we have already given the word limit for each aspect of the application. So just ensure that you stay within the word limit for your submission.
I assume that we have covered all questions. If we have missed your question, I have been trying to, like every question that we have answered, just to help me keep track, especially in the chat, given that there's a lot going on in the chat. So if we have missed your question, you can just copy it and and then paste it again, and we will try and answer it. But otherwise, it appears we have covered all the questions. So we will give it maybe a minute to see if new questions come in or questions we missed are brought up again. But otherwise, we're really grateful to everyone who has attended. We see that we have quite a lot of applications that have started. Some people have finished their applications. The deadline is January 31, 2025. My suggestion would be, take your time, try and give us the strongest application you can, and try and be as complete and as thorough as possible. We are really keen on bringing in innovations that can have the most impact on the lives of Nigerians. So we're really looking forward to the proposals that will come in. We would like to support you as much as possible. And so thank you to everyone who's been sending questions to our email. We've been doing our best to respond within 48 hours at the latest. Sometimes the responses are delayed, maybe because you've asked a question that's a bit tough, and we need to consult around it. But even then, we try to respond within 48 hours, and we give you a holding response to say, oh, this question, we're trying to confirm a few things, and respond to you. Another thing that we just want to emphasize is the problems we're trying to solve usually can't be solved in isolation. And so we really encourage, cross discipline or cross-sector collaborations, both locally and with international organizations or institutions. So where you are able to do that, please, we do encourage you to find collaborators with whom you can work. Every idea we can bring back home to impact the lives of Nigerians would be very much welcome. And so it appears that there are no more questions. We're very grateful to Dr. Owolabi, Dr. Adedotun Owolabi for helping us anchor this session. It's been recorded. Over the next few days, we'll process it and we'll upload it on our YouTube channel. And then we will communicate about it on our website and our social media channels as well. So you can either refer to them or refer your teams to them, those who are helping you put their proposals together. And then we'll have another one in January. Dr. Can you confirm the date for the next information session?
January 13th.
Yes, January 13th. So we'll have another one January 13th. What will happen between now and then is, as questions keep coming in by email and people are reaching out to us, we'll start collating those questions together. And those we will try and use to focus on the January 13th session. And then please check the documents, as we said, all the accompanying RFP documents. They are quite detailed and will most likely answer a lot of the basic questions that you may have. And for those that they can't, please reach out to us. And thank you very, very much for joining us today.